The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. I see that some people are still getting signed on, so we're just going to give them a few more minutes to get connected, and then we will get started in just a moment. Okay, we're going to go ahead and get started now. So I'd like to take the opportunity to welcome everybody to the community training series presented by ClinicTracker. Most of you know me. My name's Alicia Bazile, and I've worked with a lot of you on your implementations. We started this training series with a couple goals in mind. First, we want to help you make the most out of your ClinicTracker and BillingTracker systems. We also want to provide you with frequent opportunities to interact with our system experts. Today, specifically, we're going to be going over some features of BillingTracker, including automated fee schedules, override rules, EAP and grant billing, and then we're going to end with a community discussion where you'll have the opportunity to ask any questions about topics that we covered today and even topics that we didn't cover today regarding BillingTracker. To get us started, we're going to talk about automated fee schedules. There's two types of automated fee schedules in BillingTracker. The first is contracted insurance rates. The second is income and family size-based fees. The contracted insurance rates apply to payment schedules provided by insurance companies that include a fee for each service provided by an insurer to, provided by your clinic rather, covered by the specific insurance plan. These fee schedules can be configured by going to BillingTracker, File, Setup, Fee Schedules, Configure Fee Schedules. So let's see that in action. Okay, so we're going to BillingTracker, then File, Setup, Fee Schedules, Configure Fee Schedules. Here at the top of the form, we're going to select our service from the drop-down list. And for our example, we're going to use consultation. Okay. Once the service is selected, you can see the rest of the form populates. If there had been previously saved fee schedules, they would be listed here. On this side of the form, I can specify if this fee schedule is based on time or if we should always use a quantity of 1. For our example, we're going to always use a quantity of 1, and that just means that when the service is transitioned from ClinicTracker over to BillingTracker, it's going to be a quantity of 1 times whatever price we specify down here at the bottom. To get us started, we're going to select the insurer plan, and I have the opportunity to select all versus a specific insurer. For our example, we're going to say that this fee schedule pertains specifically to Medicaid. You'll notice that the start date and end date are defaulted to include the current year. For our example, we're going to say our fee schedule lasts for multiple years, so we're going to extend this date range. Here in the actual fee field, we're going to enter the amount that we want to go out on the claim. So for example, if we want to bill the insurance company, we're going to enter $45 here. That's the amount that will go out on the claim, as opposed to the allowed amount on this field. This is the amount that you're actually expecting to receive back from the insurance company. This helps you when you're reporting so that you know the difference between what you've sent out for billing and what you're actually expecting to receive back. Okay. The rest of the fee schedule allows me to specify things like the day of week. So for example, if this only applied on the weekends, I could uncheck these items here. For our example, we're going to say that this fee schedule pertains to all days. I also have the opportunity to change the time of day. So if this fee schedule was specific to after-hour services, I could adjust this setting here. I can also specify regular versus holiday or all. I could select a specific program or select all, credential, financial responsibility, county of financial responsibility, and then appointment location. When I'm done making the changes to the criteria here at the top of the form, I can press the Save button, and you'll see that the fee schedule is added to the list here. Now, if I need to come back later and make changes to that fee schedule, all I need to do is double-click it in the list, then the fee schedule is added back to the form here at the bottom. Now that I've made the change to the fee schedule, I'm going to close out of here, and I'll go over to ClinicTracker so that you can see how that fee schedule is going to work for us. So in order to do that, I'm going to use John Zippy, our example patient, and on the My Patients widget, I'm going to go to his patient contacts by right-clicking his name, choosing navigation, and then going to the patient contacts. Here, I'm going to select a previously recorded appointment and copy. Now I can see that the service is listed as consultation, which matches up with the fee schedule that we just made. I'm also going to change the payer to Medicaid so that the fee schedule will apply, and I'll enter an auth code simply by placing my cursor in that field, and the system automatically matches up the authorization code for me. When I'm done making my changes, I'm going to press the Save button. I'll exit out of here and go back over to BillingTracker. Now I can transition that appointment, and I'm just going to double click and transition with no co-payment. Now I want to view the log, and here in the log I can see that this claim was transitioned using a unit fee calculated using the fee schedule as opposed to the default service pricing. The next fee schedule type is income and family size based. These fee schedules apply to any client with a reduced fee eligible box checked on the ClinicTracker demographics form. You can configure these fee schedules by going to BillingTracker, File, Setup, Fee Schedules, Configure Reduced Fee Schedules. So let's see an example of that. So we're still in BillingTracker, and I'm going to go to File, Setup, Fee Schedules, Configure Reduced Fee Schedules. Here on this form, I'm going to enter a description, and I'm just going to say test. And I can specify the income limits. So we're going to say $0 to $15,000. Here I'm going to specify the family size, so I'm going to say 1 to 5 people. I could specify that this fee schedule pertains to a particular credential level. For our example, I'm going to say all. And I'm going to say that this fee schedule is $15, meaning that the patient is going to be billed $15 for the services under this fee schedule. And I can even say a minimum fee, so if I wanted to accept as low as $10 for this service, I could enter that amount here. Below, I can specify the service type. So in your maintenance menu, you can specify that services are either individual or group, or you could even select a specific CPT code by pressing selected and then using this button here to specify the particular CPT codes. For our example, we're going to say that this fee schedule applies to all services, all counties of financial responsibility, and all patients. When I'm done making my changes, I'm going to say accept. And just like before, if I need to make changes to this fee schedule later, I would just come into this form and double click the entry here at the list where it's reloaded to the bottom of the form where I can make my changes. Okay, now that I've entered a reduced fee schedule, I want to see that an example of that working. So I'll come back over here to ClinicTracker, and on the My Patients widget, I can see that my setting is right now on demographic, meaning when I double-click John Zippy's name, his demographic form is going to open up. I'm going to go to the Financial tab, where I'm going to mark him as reduced fee eligible. Okay, I can see that the fee schedule that we just created is listed here, meaning that he qualifies for this particular pricing. Now I'm going to save my change. And I'm going to click Navigate to Patient Contacts. Again, I'm going to copy a previously created appointment record. And this time I'm going to change the payer to self. Now when I go over to BillingTracker and transition this appointment, I can see that the unit fee was calculated using the reduced fee schedule that we just created. The next item we're going to talk about is override rules. There are several override rules available in ClinicTracker. These override rules allow you to change things like the transmission type, claim format, revenue code, CPT overrides, and also a billing clinician. For our example, we're going to look at a billing clinician override rule. To configure the override rules, you're going to go into BillingTracker and then go to File, Setup, and here's where you can see all of the override rules available to you. For example, here's transmission type override rules, claim format, etc. And again, for our example, we're going to use this billing clinician override rule. Now, this is going to apply when you need to send a specific clinician out to a certain payer for all claims, regardless of who is listed on the patient contact form. Okay, so at the top of this form, we're going to specify the service that this applies to. And for our example, we're going to say that this applies to all services. Next, we're going to specify the insurer. And we want to say that this particular fee override rule applies to Medicaid. We can say it applies to all programs, all places of service, all clinicians, and all credential levels. Okay. Here in the clinician to use, this is the field that is very important on this particular rule because this is the clinician that's going to be listed on all of the claim files that go to this insurer. For our example, I want to use Karen Mentis, so I'm going to press F2, and I'm just going to search for her name. When I'm done, I can press Save, and it's added to the list here. Again, just like the other forms in BillingTracker, if I need to make changes to this rule later, I just double-click it in the list, and it's added to the form at the top. Now I'm going to go back over to ClinicTracker, and I'm going to take the reduced fee eligible off John Zippy by going to the Financial tab and removing this check mark. Now I'm going to navigate over to Patient Contacts, and we'll record another appointment for him. Notice I'm changing the payer to Medicaid so that the rule will apply to this particular patient contact record. You can see that the clinician listed on this appointment is Janie Allen. Because there's an authorization code required for Medicaid, I'm going to go ahead and press my cursor into that field. The system again is matching that up for me. Now when I go back over to BillingTracker and transition the appointment, I can see that the override rule was applied here. And you can see that the name was changed to Karen Mentis, and that's who's going to go out on the actual claim. The last topic that we're going to specifically cover today is the EAP and grant billing using paper statements. In ClinicTracker, it's very easy to add an insurer plan. So when you're adding a grant or an EAP, you're going to add them in just like you would any other payer by going to Utilities and then Maintenance. On the Maintenance menu, you're going to search for Insurance. And then you're going to double click where it says Insurance Input. Here I can specify the name of the grant or the EAP, so I'm just going to enter EAP for our example. I can specify that this is private, public, self, etc. And the treatment plan review days here. So if your grant has a particular requirement or your EAP has a longer requirement, you can adjust that setting here for your compliance. Then I can enter the address where I want the statements to go to. Here I'm going to just say that our contact's name is John Smith, and I'm going to save this record. Now that the EAP has been entered into ClinicTracker, I need to go to BillingTracker to specify the insurer plan requirements. I'm going to do that by going to BillingTracker, then File, Setup, Insurer Plans. Here in the list, I'm going to look for EAP, which is the entry I just created. You can see all of the information that I entered into the ClinicTracker side is pulled forward for me. Now I'm going to specify plan requirements by coming here to this tab, and I'm going to say that this plan requires a date of birth, and you can adjust these settings as necessary based on your plan requirements. Here I can enter my accounting software link codes if necessary. Then on the Claim Details tab, I'm going to change this claim format from paper claim CMS 1500 to insurer statement. Okay. Once I'm done making my changes, I press the update button, and now I can see in the list, this insurer is now listed with an insurer statement claim format. Okay, so we just want to see an example of how that's going to work. So we're coming back to ClinicTracker. We're going to open up John Zippy's demographic form again. On the insurance tab, we're going to enter a tertiary payer, and we're going to find EAP. So now that payer is going to be available when I'm recording patient contact records for this client. So I'm going to go ahead and go back over to his patient contacts. We're going to copy an appointment again. This time we're going to change the payer from Medicaid to EAP. When I come over to BillingTracker, I'm going to go ahead and transition his appointment just like we did before by double-clicking and saying transition with no copay. This time I'm going to say no, I don't want to view the log, and I'm going to go right over to claim management. So here in claim management, I'm going to select I want to look at the queued claims, and I want to look at the insurer statements. And under the date filter, I see that it's queued today. And now I just queued that appointment simply by transitioning it. So I'm going to go ahead and click Display Claims. And here's the appointment we just created. So that you can see an example of the insurer statement, I'm going to go ahead and say Print to Screen, and then process the claim. Now the statement is generated for the EAP, which reflects all of the charges for the service we created. Okay, at this point, we're going to open up the forum for community questions. So if you do have a question, go ahead and click the raise your hand button, and we can open up the line for you. Amber's asking, how do we make a client statement? So let's go ahead and go back over here. So when making a claim, we're going to go ahead and use John Zippy again and go to his patient contacts. And this time when we copy, we're going to make the payer self, which generates a paper statement for the client. Okay, now when I go to BillingTracker and transition that appointment, a patient statement was generated. So here, I'm going to go into the claim management. And again, I'm going to look at items that were queued today, and I'm going to look for patient statements. And I'm going to display the claims, and I can see all of these are queued up for the co-payments associated with all those example appointments that we already created and the item that we marked as a self-pay. So for our example, we're going to print this item to screen and just process this one so that you can see how that looks. Okay. The next question from Karen is, can it be a question whether that you want to show us how to submit a paper claim? Okay, so a paper claim is generated very, very similar to what we've seen for the insurer statements. So for our example, we're just going to go into the insurer plans, and we'll change John Zippy's primary insurer, which is Medicaid, from electronic claim to a paper claim. So in order to do that, I double-clicked Medicaid here. It's loaded into the form at the top, and I'll go to Claim Details, and then I'll switch the claim format from electronic to paper CMS 1500. Okay, once I've changed my claim format from paper claim to paper claim, I want to specify the paper claim options down here. So you can see there's options for both CMS 1500 and UB04. For our example, we're using CMS 1500, so I'll just check my options here as necessary. Okay, and I'm also going to want to pay very close attention to this form version. Okay, so most people are on 212 now. So I can go ahead and click the Update button and close out of here, and we'll go back over to ClinicTracker and make a new appointment. Again, we're going to change the payer to Medicaid so you can see this example. We're just transitioning the appointment like you've seen several times now. And this time when we go to claim management, we're going to look at the queued items, and we're going to select the paper claim CMS 1500 queued today. Okay, and here's that item here. And for our example, we're going to print to screen. Okay, so you'll notice that this is an overlay, and you would print it out on your CMS 1500 template. Okay, Amber, I'm going to go ahead and unmute you so you can ask your question.
Hi. I ran into an issue last week where we realized that combining our claims, if people were seen for two services on the same day, if it was like case management, it's okay if it gets combined, but therapy and another service, what they were doing is it was combining it and only putting one authorization number in there.
Okay.
So they sent the instructions, but I'm still kind of lost on the manual adjustments of it, because they're saying to adjust it in the client contact page, but that would then reflect it on the progress note.
Okay, so when you have a situation like that where you initially, and just so everybody is aware of what Amber is referring to, is a setting on the options form. So she's talking about settings and then options, okay? And there's these settings up here in the upper right-hand corner. And the particular one Amber's referring to is this electronic claims combined same. And there's a couple settings available: insurer, patient, clinician, or insurer, patient. Okay. After you've made a change to one of those claim combining options, or really any option on the insurer plan. So if you've changed a claim format or something like that, you're going to want to re-queue those claims, and that's going to change the way that they're batched up. So let me give you an example of that. Okay, so we're going to go to back to the insurer plan settings for Medicaid, and we're going to change that back to electronic. So I'm just going to settings, insurer plans, and I'm finding Medicaid in the list. And then under claim details, we're going to go back to electronic. We see that there's a transmission type selected of WebMD, so I'm going to update that. Okay, now to re-queue those batches, Amber, you're going to come in here to review submissions, and you're going to adjust your date range, okay, to the date that you submitted to main care or whenever you made that batch. We're going to review submission batches here, and then select the batch from the list. Okay, so you can see that this particular batch has that one claim in here for Advantage Health Plus. I'm going to just re-queue this. Once you re-queue your claim, so this would be the claim batch that included all those combined claims, and I can look at any other electronics, and you can just keep going through here and re-queue any batch that this change applies to. So you can do multiples, okay? So you're not having to do this individual for each individual batch. Once you re-queue, you'll notice that these original transactions are canceled and new ones are created. Okay, so the new ones are going to be available under claim management. Here you're going to say, just like you normally would, queued electronic, and you're going to select the transmission type here, and everything that you re-queued is going to be available here, and when you process it as normal, the new settings are going to apply.
So where we're stuck, though, is so we offer multiple services. So if somebody is seen by case management 2 different times that day, like those combined claims would have been ideal. But what was happening if someone was seen by their therapist and the case manager, it was only uploading the APS authorization number for the therapist. It was combining 2 different services.
So do you have multiple claim records under the manage accounts?
When you say that, what do you mean?
Sure. Whoops. So I'm pulling up John Zippy's manage account screen here. And what I'm wondering is, do you have one record for the case manager versus another record for the therapist? So as long as you come in here and let's say that Janie Allen is the therapist on this and she has the incorrect authorization code, all you need to do is enter the new authorization or the updated authorization right here.
Okay.
Do you see where I am?
Yep.
Okay, so once you make that change and update and you re-queue and reprocess just like I just showed you, those new authorization numbers will go out on the updated claim batch.
Okay, so after I update from here, then I go back through and then to all those batches and then re-queue from there.
Yes, exactly.
Okay. I thought once we did the update on this end, it automatically did the re-queue, so that's helpful. Okay, thank you.
Great. Any more questions, Amber, before I move on?
Nope.
Great, okay. All right, Stacy, I'm going to unmute you so that you can ask your question. Okay, and Stacy, what's your question?
If you submitted a claim electronically, how would you go back and print the claim because, say, our insurance company wants us to fax them the claim now?
Sure. Okay, that's a great question. So you can do that on an individual claim. It sounds like that makes the most sense to talk about for this example. So if I look at this claim here and I'm in Manage Accounts and I got there using this button over here, okay? So I would highlight the claim here on the list and then go to this Transactions tab. And you can see I have this pending electronic claim. I can right-click and say Override Claim Format, and I can change the claim format to whatever makes sense for my purposes. So if the insurer is looking for a paper CMS 1500, I would select that here, or an insurer plan, or excuse me, an insurer statement. What happens is on that claim, and I'm just going to go over here so it's updated. On that claim, I can oh, I need to re-queue it first. Sorry about that. So I'm going to re-queue and then update it. Okay, so then I can process it right from here. and you'll notice that the claim type is updated here where it says insurer statement, where previously it said electronic. I would just highlight the item here and click process, and that's going to print out that insurer statement for me.
Oh, okay. Awesome.
Okay. Any more questions, Stacy?
No, ma'am.
Okay, great. Now, does anybody else have questions that that I haven't addressed about anything at all with regard to BillingTracker? Okay, great. So we can go ahead and wrap up today. There are going to be more training webinars just like this one where you'll have the opportunity to ask questions like this. I encourage you guys to take full advantage of this because we want to make sure everybody's able to use this system features and functionality. Once I end this webinar today, you're going to see a survey pop up and you'll also get an email with a survey link. We are looking for feedback so that we can make these webinars as useful to you as possible. So please let us know how we can make them better for you. Let us know what topics you'd like to see in the future, and we'll definitely take all of your feedback into consideration. And this webinar will be recorded and posted to the webinar schedule page, so if you need to refer back to it, it's available for you. Thanks, everybody, and we'll talk soon.